Hey guys, just wanted to do a little check-in. It's been about a week since I last gave you an update, and since then I have had a couple of appointments. I've had my first radiation oncology appointment, a CAT scan. I had my counseling appointment this morning. I am going to have a bone scan this afternoon, and I'm going to give blood for my radiation after that. So got lots of appointments going on this week, and I'm still trying to walk. Today I got like 3.5 miles and I was really excited. My friend Tara came over and walked with me, and I think that helped a lot. We don't walk fast. It's not like I'm a speed walker or anything, but we definitely walk, and I think that's good since it can't hurt. At least, I mean, I hurt actually. My body really hurts, especially the next couple of days, but it's okay. I'm just going to do what I can do. I also would like to comment on my cute new hat that Cullen and Kaylee picked out for me yesterday. And it is chilly here in the MD. So I'm actually just sitting on my couch getting ready to leave to go to my appointment. And I have been wearing my hat all day. But I probably should show you my hair. So this is what my hair looks like. We are like 10 weeks post chemo. August 26th was the last time I had chemo, and today is November 7th. So September, October, November. It's like 10 weeks. I think that's been how long it has been, but I can't swear. So anyway, my radiation oncology appointment went really well on Monday. The doctor that I have is amazing, and she really explained everything very well to us. I was so happy with that. I think a lot of times you can get really confused by all of the medical terminology, and Dr. McAvoy is young, and she did a really good job of explaining what I should expect, really eased my concerns about the actual radiation, and explained to me about the tumors that I have. And one was a certain size on my breast, and it shrank significantly, which they were able to determine when they did the pathology from the mastectomy. And then they were able to tell me like that my lymph node size of the tumor was 3.3, and it only went down to 2.8, which was not a very large difference. And so the chemo didn't work as well on the lymph node. And when they removed the lymph node, they told me that it's normally encapsulated in like a skin, like a kidney bean. But my cancer had gone outside of that like encapsulation, which is unusual, and it's a high grade type of cancer. So there's like residual cancer in there, which I talked about before. There's residual cancer in my breast that's in my skin, and I have residual cancer in my lymph node. And because they took 4 lymph nodes and only, I'm sorry if I'm messing you guys all up by moving so much, I'm uncomfortable. So because they took 4 lymph nodes, and 3 of the lymph nodes that they took were not cancerous, but I had the problem with the lymph node or the cancer kind of spreading outside of the lymph node. They're going to take and actually do radiation above my collarbone to where all these lymph nodes are that are up in my chest. So there's going to be a larger area of my chest that's going to be radiated. And other things that I'm sure doctors have told me, but I didn't really understand the repercussions of are the risks associated with radiation. I mean, it damages your heart, or it could potentially damage your heart. It could potentially damage your lungs. So you could have heart disease, lung disease. And there's ways that they do the radiation to try to help prevent that from happening. And there's 2 different kinds of radiation. There's photon and proton. And they're going to do measurements to see if I'm a better candidate for photon or proton, although the doctor thinks that photon, which is the regular radiation that everybody is pretty familiar with, is the better type of radiation for me. In this area, the proton place that I would go to is in Baltimore City, and even though they do everything they can to make it as convenient for the patient as possible by for instance, you just drive up to the front of the hospital and they park your car for you and they bring you your car because they don't want you to have to worry about that. The machine is not reliable. The proton machine is not extremely reliable. So often you'll go to your appointment and you'll have to wait an hour because they have engineers working on the proton machine, or they have to reschedule you. And it's just not as dependable as like the regular radiation. And I'm honestly really cool with the regular radiation, especially after having such a great conversation with my doctor about it and her easing some of my concerns. In addition, my doctor told me that I am qualified for a clinical trial for radiation. So the similar type of trial has produced positive results for women who have not had reconstructive gel implants, which I did. So now, since they did this study on women that didn't have implants, they're now going to do the study on women with implants, and I am a very good candidate. And she did not say either way, you know, you can do this, you cannot do this, whatever you want. She didn't say you have to do it. But as soon as I heard it, the benefit is that you only have to do 16 chemo treatments versus 25, and you get the same amount of chemo that you would in 25 sessions as you do in 16. And I mean, I'm all over that. You don't apparently get more burned or more red or anything like that. They're just radiating you in a higher dose. So they're just clicking up the notch a little bit. And this just sounds like something I really want to do. And I would be honored to be part of a trial. So, and there's no negative. I mean, I'm getting the same amount of chemo as I would in 25 sessions. So the only problem is that it's a lottery. So you have to kind of apply or buy a lottery ticket and see if you get selected. So I'm going in to give blood work for that today, and then I'll find out on Wednesday, I guess, or maybe I'll find out after Wednesday if they selected me as part of the lottery. So found out more information, you know, just as a reminder, I'll have to do tamoxifen, and that is a hormone suppressant. I'll do that once I start radiation. Interestingly enough, I'm having a coffee date with my friend Meredith. She goes to the restroom and I start reading the drug interactions for the tamoxifen and find out that I am on an SSRI Prozac, which is fluoxetine, is the generic name for it, and that causes a negative interaction and makes tamoxifen not work. And that one sent me over the edge a little bit because I really feel like I started taking Prozac 4.5 years ago. 6.5 years ago when Aiden was 4. And it really helped balance me out with my anxiety and my need to control everything. And so I was really worried when the doctor told me I'm going to have to go off of Prozac. They're going to put me on something else, but, you know, I've just had a very positive reaction with, or positive sense with Prozac. So, you know, part of this journey is total and utter anxiety and potential for depression, and which I've been fighting by going to a counselor and talking to people. And so I'm kind of nervous. So I went down in my milligrams for my Prozac. And so I want you to know that, you know, I have to change the subject for a second, but I'm talking to my counselor today and trying to figure out what is going on with me and realizing that I have lost trust. I have lost trust in people. I have lost trust in the process. I have lost trust in treatment. I've lost trust in diagnosis. And I have lost trust. And that is so huge for me. And that's why I just am feeling overwhelmed, because it just doesn't feel like anything that's supposed to happen is going to happen. It just keeps waffling all over the place. And I'm recognizing that this is part of this acute illness, that change is inevitable and everything isn't going to be what it is. So I just really have to adapt. So I was trying to not get overwhelmed when the doctor was like, okay, you can't take Prozac now, and just, kind of go with the flow. But lots of doctor's appointments are making me feel like I need to take extra time for myself. So I actually made some dates to go out with friends, and I'm just gonna stay at home and try to gather myself and work on my inner circle. If you guys remember when I first went to my counselor, I posted the pictures of like the circle, and I'm the center of the circle, and then I kind of have to go work my way out. And I think I'm pushing myself a little bit and didn't even realize it, just because I'm not dealing with it. So that's the kicker, is that when I make plans to do things, and I'm out and about running errands or trying to drive because I couldn't drive for 4 weeks, that I'm just not dealing with what's being put in front of me. And I'm trying to do that. It's just really hard. I don't even realize that I'm ignoring it or trying to put it off until I go to something like a counseling appointment, and there's like all this weight. It feels so heavy. You feel so heavy, and like everything is just weighing you down. And then you have this revelation where you realize, oh my gosh, I'm losing trust. That's what I'm losing. Where before cancer, trust was my initial reaction, is I trusted you. I didn't not trust you unless you hurt me, and you'd have to do it like 3 times before I would like say, get out of my life. But now I don't trust a lot. And there's maybe a handful of people or less that I trust right now. And it's very exhausting emotionally to try to regurgitate what is going on with me, all of the details of the information from the doctor, etc. And my counselor's recommendation was to utilize one person. And I think she said this before, and I think I was like kind of maybe using Rob, but I think I'm going to go a little bit further out. I don't think Todd watches these videos, but I'm probably going to ask him to be my, like, I don't know, mediator of some sort. Maybe he can communicate information. He's been really good about it. But anyway, I mean, I think this is what, when I'm watching all these social media posts from people that have similar disease as I do, they're so good at articulating how they feel, and I just say thank you to them often. I'm reaching out to them and saying thank you, because they're really able to say a lot of what I can't say, can't get it out. I don't know how to get it out. I don't even know it's happening. So, I do these videos to try to educate you guys and make you understand, not make you, but help you understand what I'm going through and how this is affecting just me. I'm different than everybody else. It's not like this is going to be the same for everyone, but just understanding that every single day is a struggle. It's hard to put your constant fear of what's going to happen to you. I had to have a CAT scan because I have nodules on my lungs that may be nothing. And when I first was diagnosed and I had a PET scan, they told me I had these nodules on my lungs, and I didn't think anything of them. I was just too concerned about breast cancer. And then all of a sudden we start talking about the radiation, and they're like, well, we have to do another scan because we have to check those nodules. And I'm like, oh, those things? Was that a problem? Well, it could be. It's not. They check the paperwork and the scan, and I'm totally okay, but they're going to watch it, and I'm going to have scans every 6 months, and they're going to make sure that no changes happen. But I'm like, crap, that's another thing I got to worry about. And am I going to get heart disease? Am I going to have lung disease? Am I going to have melanoma from radiation? There's just so many things to worry about. That doesn't even include, like, I have kids. I want to make sure they're okay. They're going to have kids. I have parents. I have siblings. That's just normal stuff. Then you just pile on all this other stuff. Oh, but this is the time for me to be like, I love my eyebrows. So I don't know. It's just, I'm inviting you into my crazy world. So I'll let you go for now because I'm almost at 15 minutes and I hate when I rattle on for too long. But as always, if you have any questions or you have any comments, let me know. Thank you for listening. Thank you for continuing to support me. I know that I say thank you, but I really want you to understand that your comments and your well wishes and your prayers and your good thoughts, and when you send me a card or a note or whatever, it means so much to me because it reminds me that there are people out there that really care about me and what I'm going through, and it really uplifts me. And so I just am so grateful for that. I also want to say thank you, as always, to our military and our first responders, but especially because Veterans Day is coming up. And I want to thank those that have committed service and been there to make our lives for free. I mean, I was telling Aiden, I want you to recognize that there are people in our family and our neighbors and our friends that are veterans and that have served. And I want everybody else to make sure they understand the difference between Veterans Day and Memorial Day and Armed Forces Day, and just thank a veteran. And a veteran is not an active duty military person, as far as I know. That's Armed Forces Day. That's for active duty. So anyway, thank you. 15 and a half minutes. I will talk to you guys soon.